So I'd now like to introduce Associate Professor Mangor Pederson from AUT. Mangor's been developing some really exciting new ways of analysing brain images and outputs using MRI, or magnetic resonance imaging, EEG, I won't even try and say what that means, and AI, artificial intelligence. So Mangor is going to be sharing some real hot off-the-press stuff today, so you're the first to hear this, looking at brain images of athletes who have sustained a mild TBI or concussion. So thanks, Mangor.
Kia ora, and thank you for that lovely introduction, Alice. It is truly a privilege to be here today. Just the idea of the community and us as a researcher and the health care services coming together is a truly unique opportunity, and I'm excited to talk to you today about some new results we have, because my research is what I often call the silent B in TBI, is the brain bit, what happens in the brain, which is sometimes quite unknown to us, because the brain is a very complex organ, but we've made some work in terms of trying to understand what's going on in the brain after people are having a brain injury, so we can understand the condition better. So sports-related concussion in general had this definition for a long time, that when you have a concussion, you go to the hospital. If you go to the hospital, you see nothing on the MRI yet. It's going to be normal from the radiologist. That almost always happens in a sports-related concussion. Also, there's a definition that there's only the function of the brain that is abnormal after a concussion. And to me, as a neuroscientist, there's always been not sitting right with me. Say rugby, for example, which we're going to talk a little bit about today. You have a very bad tackle on the pitch. Your head gets hit, you might hit the ground, you might have a bit of posturing, and to say that this injury is just functional never sit right with me. Something more must be happening in the brain in the mild traumatic brain injuries. This was reflected in more recent definitions of sports-related concussions. This came out last year and was an updated guideline of sports-related concussion. Are they here? Ah. Can I have my slide here? I can see them, but you cannot. There you go. So the first part was that we have the old definition of sports-related concussion, which is a functional disturbance, but the updated version is that we can now have axonal injuries, so your white matter pathways can have some damage, blood flow changes, and inflammation changes of the brain. Still, the definition is that no abnormality will be seen on an MRI in a hospital, which will give you the sense that there is no abnormalities in the brain. But as we've seen all morning, we know that TBI have a lot of symptoms, cognitive symptoms, psychological symptoms, sensory symptoms, so we know that these must arise from the brain. So our research question really was, with new technologies, with new capabilities in terms of MRIs, in terms of how we can image the brain, can we detect more subtle brain changes that are more structural in nature? And this will really help us understand what's going on in the brain after brain injury. I'm going to talk about three things that happens in the brain today. One of them is inflammation. So inflammation is, particularly in mild traumatic brain injury, often a positive process that happens in the brain. It is your firefighter cells in the brain activating in terms of recovering from injury, much like you get an inflammation in your ankle when you play soccer or anything where you might injure your brain and get swollen ankle. We're going to talk about iron. Iron is a different compound that we can now image, which has more long-term consequences for brain health. And we're also going to talk briefly about the axons, so the white matter pathways of the brain. So what was our study cohort? Our study cohort was, in this study, 20 male sports players. As we discussed a lot this morning, both the biological and some of the social consequences can be different between the sexes. So in this study, we study male participants because these are the ones we have most access to in the sports population, but definitely for future studies, we really want to understand the differences between male and female athletes as well. This is a young population between 16 and 35. Our average age is quite young, it's about 21 years of age. So these are brains that often, people who have often not have a brain injury before. And it's an acute injury. So we scan them within 14 days of injury. So they're still in a very symptomatic state of the injury. We also have a control population of 44 male controls matched to the age with no TBI, recent history of TBI or any symptoms of TBI. When it comes to brain imaging, there is one big issue. So this is a brain image called a T2 image. It's a very common thing to do in the hospital. The issue with a brain image, like the one you see on the left here, it is what we call qualitative in nature. The only thing you can do with this image is look at it and see if something is abnormal. In terms of scientific approaches, there's not much more we can do with it, which is why you go to the hospital and you get a visual inspection of the image from a radiologist, and that's the end of the road. What we need to do is to get the image from qualitative to quantitative. Quantitative means numbers, so we can get numbers out of it, and then we can look at more subtle features of these images. I chose this image. It's this calcifying lesion that you see here, but the point is there's a lot of water around it. There's inflammation around this lesion. And you can see these T2 images, they go bright in the presence of water, and inflammation is water, so you can then image inflammation with these processes. So how do we do this? How do we go from qualitative to quantitative? We do this by taking 8 of these images that you see here, with different type of contrasts. So we're taking multiple pictures. Each of these pictures individually are qualitative, but if we draw a line through each of these images, we get this curve that we see here. That's a signal curve of the image. This curve has a number to it. It has a millisecond to it. It has a millisecond denoting what tissue is the signature of that brain region. So let's look at this a little bit further, how we can do this tissue. This is the same type of curve. And basically what I want you to look at here is that the turquoise, the cyan one on the top, that is very high, so very high T2 values. That's your CSF in the brain, so cerebrospinal fluid. That's a fluid going through the ventricle to clean the brain several times a day, particularly when you sleep, which is why it's so important to get good sleep, because your brain re-cleanses itself during the sleep. But this is it's a fluid, so it gets very high contrast. What we are interested in is the gray matter. This is your neurons, where we think there might be subtle changes going on. That is the blue line you see much lower, so we have much lower signal. But we are looking for this blue signal and see if there's subtle increases here. The red one is blood, which is more of a liquid quality. We do not believe if the radiology report is normal, there's unlikely to be blood in the brain or any bleeds in the brain, because that will be visible on the images. Okay, so now we've gone from an image to an image with numbers. An image with numbers we can quantify, which makes us very happy, because now we can give numbers to it and say it's increased, it's decreased, instead of just it's normal, we can't see anything. But what we care about in this context is every single of these 20 players, these are mostly rugby players, about 90% rugby players, as is expected in New Zealand, Aotearoa, but we care about every single of these brains, and we want to look for abnormalities in every single player here. And we want to do this with individual level statistics. And if anyone here has a background with statistical analysis, we often know we need lots of people in one group, lots of people in another group, and then we look at trends towards the group. But this makes it very hard to say, this person has this change in the brain. This person has this change in the brain. We're just looking at averages, which is not going to be that clinically meaningful. So what we have developed is this approach where we can look at statistical analysis from these individual subjects. So what we have here is a hypothesized T2 relaxometry scan from one of our players. And what we do here, we're subtracting all of these T2 values, so these increased inflammation values, with the average from our 44 controls. We're then subtracting that with a standard deviation from control. And if you again have had some statistical background, this is what we call a Z-score equation. So it's the difference between our one player and the healthy population, which leads us to this kind of brain map, where hotter colors here means that the player will have higher inflammation in these areas that you see here compared to controls. We applied some fancy statistics to this because in terms of brain imaging, we have about 800,000 variables because we're looking at tiny parts of the brain. And then we get a statistical map of the part of the brain which have higher inflammation than other areas. So what are our results doing this type of technique? What we observed was that 19 out of 20 of our players showed brain regions with higher T2 relaxometry than controls. So in 19 out of 20 players, there were evidence of increased inflammation. None of our players had any findings from the radiologists. So all of these, had they gone to ED or to the hospital, they would have a brain that would have said normal. So stark contrast with what we can see with quantifying numbers and qualitative assessment. Let's go through some of the players that show different type of abnormalities. So you get a feel for what could commonly happen within the players and between players as well. This was the first one we scanned, and I sat down with my student. I looked at the results, and we observed that several parts of the brain had more water qualities in the brain or more inflammation areas. This is the motor cortex, so involved in motor functions of the brain. This area that you see in the middle is very interesting. It's called the insula. This is where the main immune response of the brain is located. So we know that inflammation is an immune response, suggesting a particular inflammation in this area. I'm going to tell you a personal story now, because our study initially was just to look at the initial scan from all of these players and then see if that predicts long-term outcome. We looked at these brain and we were a bit concerned. Our main question was, is this a permanent damage or does it go away over time? So we changed our study protocol slightly after we saw these images, and we decided we want to get players back in a scanner after they feel better, so after clinical recovery. So all these three players that I'm showing today have had a recovery scan. And what we observed on the recovery scan was that these brain areas returned back to normal or back to baseline after the recovery. So these are, what you see on the recovery is the acute scan minus the recovery scan, and you see that these areas go back to baseline of healthy controls after injury. This is another player as well. Same pattern again, the insula that you see here. So an immune response of the brain. Also an interesting area at the back of the brain, that this is called the cerebellum, which is involved in how steady you feel, your coordination, and feeling unsteady. This player in particular complained a lot about not being able to stand right, feeling very dizzy, feeling very unstable. So we also observed for many of these players, the parts of the brain fitted with the symptoms that we saw. Same parts of the brain also recovered after clinical recovery in this participant. Third participant also complained a lot about motor symptoms. This is the motor area of the brain showing increased T2 water qualities in the brain, and the same area also recovered after the injury. So a pattern emerges that We can see a structural response in terms of an inflammation mechanism, but it also seems to go away after the injury. This is in line with a previous study we did. This was on just a one case and not near like 20, but this is a footballer who got injured 3 times, and you can see these inflammation responses on all of these 3 scans, whereas the recovery scans show no changes. So suggesting that it's a mechanism that is now confirmed across 2 different studies. The inflammation of the brain is a interesting construct. We think about inflammation as a beauty and a beast kind of thing. Inflammation is there to help you recover, but if you have too much of it, it can lead to a devastating consequence as well. So we do think we can image this process now. It goes from days to months to years. As we know, TBI is complex, but as a proof of principle, we believe we have the imaging now that we can look at these processes. So moving further from inflammation and over to iron. So this is more a work in progress, but this is a very, very exciting imaging technique called quantitative susceptibility mapping. And now the bright areas you can see of the brain is areas with more iron in them than others. So this is the basal ganglia that you can see masked here. And the basal ganglia contains a lot of iron. We know accumulation of iron is a predictor for things like neurodegenerative processes later in life and so forth. So a very, very interesting technique to measure long-term consequences of TBI. Our question was, what happens with quantitative susceptibility mapping in acute TBI, however? We saw the opposite pattern. So this is the caudate nucleus, is a main part of your basal ganglia, important for movement, contains a lot of iron. We observed significantly decreased iron levels in acute concussed rugby players compared to controls. It was very consistent findings, and one that we still figuring out the mechanisms of, because we know the long-term consequences of mild TBI. We expect this maybe that it should decrease. So what is this short-term mechanism in relation to a long-term mechanism is an outstanding question. And the third technique we're also working on now is taking this study we did a couple of years ago and moving on to the single subjects like we did with the inflammation work. This was work we did over in Australia, looking at the white matter of the brain. The white matter of the brain is the one you see on the news when you see any sort of brain report, because we get these very nice, bright brain images that looks awesome. But this is the white matter pathways of the brain, so it's the signaling of the brain. What we observed in this study was that there was significantly increased white matter densities, so the pathways of the brain in acute TBI compared to healthy controls. But this was not the case for subacute. So acute here was the first 14 days, which is the same as our cohort. So we want to look at individual patients again, individual players again, to see these different patterns in individual subjects. So what does all of this mean for me? Well, first of all, it validates that there are subtle structural brain changes after TBI. It's worth emphasizing subtle again, because all of these 20 players had normal MRI from the radiologist, so you can't see any changes with your eyes. We think we are looking for an inflammatory response, a mechanism of recovery after injury, which can give people more certainty about when you can recover, potentially, and how you are going to recover. We really need to understand the relationship between this acute, this is the first 2 weeks after injury. We know that traumatic brain injury is often a lifelong condition and an event, and in terms of especially the chronic effects of of mild TBI. So understanding the acute effects and the chronic effects and combining them together, I think is going to be a large part of solving this this puzzle. So with that, there's so many people to thank. I particularly want to thank my incredible PhD students on my end who did the T2 relaxometry work for a thesis, and Christy, who did all the QSM work and currently doing the diffusion MRI work. And I want to thank you for